Head injury demands immediate attention. We must put every effort to prevent it. Unfortunately, if there is an injury, you should be transported to the hospital safely. In the hospital, a CT scan can determine the location of the injury, size of the injury, extent of brain damage, and associated complications. Before we do that, in the emergency department, it is mandatory that we check and maintain all the vital signs such as airway, breathing, and circulation is stabilized, and then we must investigate. Head injury can be of many types. A person can lose consciousness and regain completely and become normal. So this we call it as cerebral concussion. A part of the brain can get injured, becomes like a pulp, and this is called cerebral contusion. And brain can have extensive damage, and this is called cerebral lacerations. Apart from that, depending upon the severity of the force the head receives during the injury, a variety of blood clots can happen inside the brain. And these blood clots can cause compression over the brain, and they can keep enlarging, causing significant brain damage. So the blood clot can happen on the brain's membranes, between the skull and the membranes. This is called extradural hematoma. The second one, it can be between the dural membrane and also on the brain, and this is called a subdural hematoma. And the blood clot can be inside the brain itself, either in the big brain or in the small brain, and this is called intracerebral hematoma. And depending upon the location and depending upon the source, these hematoma can enlarge. The blood clot can enlarge very rapidly, making the person unconscious, compress the brain, and can deteriorate and slip into coma very rapidly. So every minute counts. Therefore, we need to act immediately and relieve the compression and remove the blood clot at the nearest possible neurosurgical facility, so that we can protect the brain, we can save the life, and we can make him come back to normal faculties.